G'day! Today we are going to talk about shockwave therapy and whether it works as a cure for erectile dysfunction. By the end of today's short talk, not only will you know if shockwave therapy helps erectile dysfunction, but you'll also understand a bit more about what shockwave therapy is, what it would feel like to have shockwave therapy, and a little bit understanding about the different types of shockwave therapy, and most importantly, understand if you are the sort of person who would benefit from shockwave therapy. I'm Dr. Simon Snook. I'm a sexual and reproductive health specialist, and this channel is the Kiwi Sex Doctor, where I give you tips, tricks, and hacks to help give you a better sex life. So what is a shockwave? Well, the hint is in the name. It is a wave of shock. Okay, all right. So it's an energy delivered by an external machine in the form of a very high energy sound wave that delivers that energy and disperses it into a body tissue, in this case, the penis. What is the idea of that? Well, if you deliver energy high speed into a tissue, it will cause microscopic damage to that tissue. So here you're going, okay, I've got erectile dysfunction. I know, let's go damage my penis more. That sounds like a good idea, doesn't it? Well, here's the theory. We're not talking about damage where you're going to break your penis, okay? What we're talking about is delivering microscopic damage, in other words, shaking up the cells and the tissues around there to make the body realize that it needs to repair that area. Now, this damage doesn't cause any functional problem with your penis. So the theory is that the immune system, the body's repair systems, go into the area to correct this microscopic damage, and during that, they lead to new tissue formation, and specifically in this case, new blood vessel formation. Therefore, you can improve the blood flow to the penis by causing this microscopic damage in the first place. So where did this idea come from? Well, look, shockwave therapy has been around for quite some time. It's been used in all parts of medicine, seeing if we can deliver energy in this way to cause tissue regeneration, whether that be in sports medicine and injuries and that sort of thing. Also, in the area of urology, shockwaves have been around for a very long time in the form of lithotripsy. Now, lithotripsy is a treatment for people with kidney stones. And they have shockwaves applied to their body with the plan that those shockwaves penetrate the body and get to the kidney stones and cause them to break up. And then therefore stones that were unable to be passed from the body are broken up into small pieces and can be passed out in the urine. Now, what happened was a number of people who went through lithotripsy treatment started to suggest that as well as their kidney stones being gone, which was a pretty good thing, they felt that their erectile function was improving. So people put the two and two together and decided, well, let's just see if we can deliver shockwaves to the penis alone to improve erectile function. So who might this therapy work for the best? Well, look, all I've talked about so far is about tissue regeneration, new blood vessel formation. So this is going to work for you in theory if your erectile dysfunction is due to an issue with blood getting into the penis. Now, that is actually probably about a half to 3/4 of all men with erectile dysfunction. And we're not talking here about major arterial blockages or anything like that. What we're talking about here is just in general the quality of blood flow through the smaller vessels into the penis. Now, this sort of thing tends to happen with aging. Anything from the age of mid-30s onwards, our tissues throughout the body tend to start to lose quality a bit. You can see that in your skin. Your skin starts to get less supple, your joints are less supple, you get more injuries, you can't bend as well, and also your small blood vessels, especially those in the penis in this case, tend not to be quite as well dilated or branching around. Therefore, the blood flow into the penis in response to a sexual stimulus is a bit less, and this decreases over time, and men with this type of erectile dysfunction tend to give a story of their erectile function getting slowly worse from anything from mid-30s and later. There are, of course, a number of other causes of erectile dysfunction, in fact, many other causes, from psychological erectile dysfunction, where the problem is with the thought processes in the brain, and of course, clearly shocking the penis is not going to do anything for your brain. People who have low testosterone levels, again, no help there. So this sort of therapy is only going to be valuable if you have a blood flow problem. And one extra caveat to that, there are a group of men whose issue with erectile dysfunction is due not to the issue of getting blood into the penis, but due to it leaking out again more quickly. The reason you get an erection is blood flows in faster than it can get out, and therefore the penis engorges with the blood and gets hard. Now, for some men, they have this issue called venous leakage, where the blood flow in is not too bad, but it's flowing out again quickly, and the type of shockwaves used here will not help with that venous leakage. But that is a much smaller group than the group we're talking about. So the question you mainly came here for, I am sure, is does it work? The answer is yes, it does. Categorically, it works. So feel free to just give me a thumbs up, subscribe, and you can head off now if you want to. But before you do, there are a few more things you should know about this. So the early studies that showed that shockwaves worked used these machines called focused shockwave machines. Now, these were quite expensive machines and not many clinicians had access to them, but in all of the studies they showed they worked very well. Subsequent to that, clinicians started to try and use something called radial shockwave therapy. Now this is where the shockwaves are delivered much more diffusely across the penis rather than in the focused way that the other shockwaves were delivered. Now in theory that should work well, but no one for a long time had proved that that method worked. The radial shockwave therapy has many different protocols. One of the most well known is something called Gainswave, which is a specific protocol which was patented by the beautifully named Dr. Richard Gaines, or to his friends, Dick Gaines. And that is one that's mainly seen certainly in the United States, but is one of many different types of radial shockwave therapy. Anyway, the important thing is over the recent time, there have been some really good quality studies showing that radial shockwave therapy does indeed work as well as focused shockwave therapy. Now you may see, if you read about this from in other places, you may still see a lot of comments relating to focused shockwave therapy being the only one that's proven. That's why I do add this in here. So now that we know that shockwave therapy works and we know the type of man who would benefit from shockwave therapy, you probably want to know what it feels like to have it. And I did mention earlier that shockwave therapy causes microscopic damage, and some of you might be a little bit cautious about the idea, thinking damage equates to pain. I can categorically tell you that shockwave therapy is not painful. There may be a little bit of discomfort when you start getting it, but you get very used to the sensation very quickly, and most of the treatment session is virtually without any discomfort at all. The treatment is delivered using some form of probe pressed directly against the penile tissue, and individual shocks are given very quickly, so very rapid fire shocks delivered to the penis. And in most cases the probe is moved around on the shaft of the penis, often the head of the penis, and usually underneath the scrotum, delivered to the erectile tissue at the base of the penis where it attaches to the pelvic bone. A session of shockwave therapy is likely to last about 20 to 30 minutes, during which time all of the shockwaves are delivered to the penis. And in most cases, most people suggest that you have multiple treatments of shockwave therapy every few days, every week or so, for anything from 3 to 15 shockwave treatments, depending on the protocol and the clinician you're seeing. And it's very hard for me to sit here and say which version is the best. We've proven shockwave works. We haven't necessarily established what is the best type of protocol to deliver it. So it's worth asking around what you might expect and how often that treatment provider thinks you should have the treatment. as I said, the idea of this treatment is to promote new tissue regeneration. And just like if you were to damage your body another way, if you were to cause a cut to your hand, you don't look down a moment later and see the tissue regenerated and healed. It takes days, weeks, and even months for the full healing process to occur. And that is no different in delivering shockwaves to the penis. So your erectile function will not noticeably be better the day after you've had your shockwave. But with time and with multiple treatments, those healings build up and your erectile function improves. And it will stay around for a significant amount of time, though not forever. The tissue will still continue to degenerate as we age, and you may then require further shockwave treatments in the future. But there's no evidence that having this repeatedly causes any harm, apart of course to your bank balance. So you can have treatments as often and as regularly as you need it to establish the erectile function you need. So I hope that's been helpful to you today. Please do give me a like and subscribe to my channel if it has been useful. The idea of regenerating penile tissue to reverse erectile dysfunction is a really exciting thing. And there are quite a number of different types of treatment that look at doing the same thing, one of which being something called platelet-rich plasma, or the P-shot. And I do have another video looking at how that works and whether indeed it does work, which you're welcome to go and look at. And I do have another video comparing shockwave therapy to platelet-rich plasma to help you decide, if you had to choose between them, which one to go for. Please do give me some comments on these videos. This one particularly today has been done because someone commented in the video field and asked me to talk about shockwave therapy. So your comments are always listened to. I'll reply to them whenever I can. And if you do have a request for a video or some information, please do share that with me. Thank you for your time today and take care.